I know this is controversial for a lot of people. It's bad advice from healthcare professionals when they tell you to walk for your meniscus and your meniscus hurts. Here are the top 7 worst treatments to avoid so that you can heal a torn meniscus. Number 1 is quad exercises. What I mean by quads, for those of you that may not have heard that before, it's the muscles in the front of your thigh. The muscles right here, they connect up into the hip, on the front of the hip, and then they attach to the kneecap, and then they send a ligament down into the shin bone and attaches right here, so it skips over the knee joint. You can see it better on this model. Here's the tendon for the muscle, and then there's the kneecap, and then here's the ligament that goes down into the shin bone. These quad muscles are a huge problem in adding excessive pressure into the knee because of their attachment. That's why I described it to you. If they're really strong, then at rest, you just sitting around, they're going to be pulling, they shorten. And so it pulls everything up, and it pulls the kneecap up against the thigh bone right here, and then it pulls the shin bone up into the thigh bone, which squashes your poor meniscus. This is why some people that have a meniscus tear, they'll just be sitting around, watching a movie, having a meal, just sitting for an extended period of time, 30, 60 minutes or more, and their knee aches and throbs. It's because those quads are so overactive because they've been strengthening them in an effort to help, but it's actually hurting. At rest, they tighten. They stay tight. They never let go. And so they add compression to the joints, which squashes the meniscus and aggravates the tear. So you should not be strengthening your quads more because that's usually what led to the problem to begin with. You're getting excessive compression into the knee joint. Now, I know this is controversial for a lot of people, and I'm okay with saying that because I've had so many successes in helping people heal their meniscus tear by completely avoiding quad strengthening and instead going elsewhere. We strengthen the glutes, we strengthen the foot. There's other things to strengthen that actually help the quads to let go and behave normal, because you still need to use your quads. Your quads are going to be used. You can't live without your quads. They've just been compensating too much. They've been overactive, and when they get used too much, they start to shorten at rest, and that's what causes this compression problem in the knee. So I think you should absolutely avoid all quad strengthening if you're trying to heal from a meniscus tear. Avoid knee extensions, avoid quad sets. You should not be trying to actively strengthen your quads or make them work better because they usually are already working too much. Number 2 is hamstring curls or hamstring exercises. Hamstring curls is usually the common one that's done. That's where you're bending your knee to strengthen the muscles on the back of the thigh. Now, this one is less of a problem, but I still see it as a problem because where those muscles attach, I don't have a model that shows it very well, but the muscles start right here on the bottom of the pelvis bone, which is where you sit most of the time. The muscles fan out and they come onto the sides of the shin bone. And because of their attachment, they go past the knee joint. And when those muscles become overused, they, like the quads, they start to shorten, and they can also add compression to the knee joint. A lot of people think that you need to strengthen the thigh muscles in order to help the meniscus, but actually you need to let them get a little weaker, or you need to put them into balance really, where other muscles up here are stronger relative to these. Sometimes it's a matter of getting these weaker. Other times it's a matter of maintain the strength there. Don't necessarily get weaker, but increase the strength up here in the glutes and the back of the hip so that relatively you're stronger up here and weaker down here, but you didn't really lose any weakness. You didn't really lose any strength or get weaker. You just shifted the balance, the muscle balance. That's what changes the pressures at the joint and allows you to heal the meniscus better. So I would avoid doing any hamstring exercises if you're trying to heal your meniscus, because then you're going to decompress the knee joint if you can allow yourself to get stronger in other areas or get relatively weaker in the thigh muscles. Number 3 is a common exercise given by healthcare providers. It's leg raises. So the idea with this one is you're lying down. So just imagine this skeleton is lying on its back. So gravity's pushing down this way. A leg raise would be you're picking your leg up this way, straight up in the air, usually with the knee kind of straight. And the idea is to focus on strengthening the hip flexor muscles on the front of the hip, which directly oppose the glutes on the back. So it's going to make the hip flexor stronger and the glutes relatively weaker. I think this is a bad idea because one of those hip flexor muscles is a quad muscle. The rectus femoris muscle attaches right here and it crosses the hip joint, goes into the kneecap. But because it crosses the hip joint, it's technically a hip flexor. It's on the front of the hip. Along with the other hip flexors, it can create a muscle imbalance that puts bad pressure in the hip, but also increases that pressure down in the meniscus. So leg raises, commonly done exercise, I have people stay away from, and we successfully help them heal their meniscus. One of the imbalances, a deeper muscle imbalance that I look at on the front of the hip is the imbalance between the hip flexors and the lower abdominals. Because they're neighboring muscle groups, the hip flexors often compensate for weak abdominals because you can get stability in the area from the hip flexors if you have weak lower abdominals. But if you can strengthen your lower abdominals, then usually the hip flexors can begin to act normally and not overcompensate anything, including your poor meniscus down in your knee. The number 4 worst treatment is using a knee brace. Now, this one's more neutral than harmful, but it can become harmful. I put it in this list for that reason. Using a knee brace or like a knee support, whether it's a neoprene, just like a sleeve, or one that has brackets or struts on the side to help give stability to the knee, I don't think it's necessary. And unless, the only exception that I have for people is if you have an ACL tear along with a meniscus tear, then in that situation you do need a brace. And you need a heavy duty one with the hinged brackets on the sides because of the ACL. It's really the ACL that requires a brace because the ACL is a ligament that's important to the stability of the knee. And if you have a tear in it, you need a brace. It's absolutely necessary in the early stages of healing an ACL injury. But if you only have a meniscus tear and you do not have an ACL injury, then you don't need a brace. There are cases where I tell people it's up to you if you want to use it. The differentiating factor is your disposition on the brace. And here's what I mean by that. If you're the type of person that puts the knee brace on every day and you wear it all the time and you don't feel comfortable living without the brace on, then it's probably a good idea for you to not be on a brace to begin with, if you feel like you're going to be that kind of person. Now, if you put on the brace at times and you feel like you could live with or without it, but it adds that little level of comfort for you, that level of confidence for you, then having a brace on is going to be okay. My concern with people that wear a brace is that they become dependent on it and then can't wean themselves off of it. Because in that situation, you build a psychological fear of not having the brace on, which can potentially stop you from progressing into the higher level of activity that is going to eventually be required of you in order to properly heal your meniscus. And it becomes a limitation at that point. I've seen people reach this point where I tell them, all right, your meniscus is healed. The tests are all clearing out. I'll do hands-on tests. You might even have an X-ray, or an MRI that shows that your meniscus is good, but people have this need to still have the brace on. It's like a safety blanket that they need to have it on, and you don't need to have that. It's going to subconsciously cause people to move inappropriately because you have to get to the point where you're confident in your knee. And if you're putting on the brace, it's a sign of a lack of confidence, that you need some external support in order to do that activity. Walking, running, jumping, weightlifting, whatever it may be. But if you can get yourself to where you can live with or without the brace, then I'm okay with you having the brace on for short periods of time, especially if you're trying to just avoid taking pain medication or avoid having to use ice or something else like that, then it's okay. But I really think if you can just not ever have a brace to begin with and you don't have an ACL tear, just let it go. Don't use it. It's not really adding a whole lot of stability to your knee anyway. If your ACL is intact, that's the main part of stability that you're going to need for your knee. Number 5 is resting. I see this way too often where people get a meniscus tear. They have the diagnosis from the doctor, and the doctor will even often tell them, you need to get off your knees, you need to rest, you need to not be on your feet, you need to stop activity. And people will take it to the extreme where they don't move more than what they just need to for the regular day. They'll stop all activity. At the beginning, maybe for like a week or two, that's the right thing to do potentially. Some people can still tolerate some movement without pain. But what really needs to happen is relative rest. I think that's where everybody's verbiage needs to change as far as the medical field. We need to be doing relative rest. In other words, do what you can without making it worse. That's a simple way of explaining relative rest. So if you can walk around your house to do your normal activities like your chores, your cooking, cleaning, taking care of yourself, that kind of thing, do so. But if it hurts to do those things, then you need to back off and figure out how to get them done with some help, or avoid doing them for a little while. You can only do what you can without making it worse. On a tissue level inside the knee, your meniscus, when it's injured, when it's torn, has a tolerance. It can take so much. You need to be using it within that tolerance, because if you just take it to the extreme where you're just in bed lying down all the time and not moving your knee, that's not productive for your knee joint, because the fluid inside, the synovial fluid, there's liquid inside your knee that helps to lubricate all the parts of the knee inside, and it helps to nourish it as well. That stuff will stay still. It stagnates, and you need a flow in there because your heart doesn't make it flow. Your heart circulates blood around your body and it makes the blood flow. That's why they call it blood flow. But the joint fluid inside doesn't have a pump, a pump that's going all the time anyway. Its pump, or its method of movement, is your knee moving. So you need movement in your knee. It just has to be a movement that you can take without hurting it, because that movement will allow the fluid inside to circulate, which will allow the bad products to come out, the waste products, and allow the good nutrients to come in. The lining of your joint, of your knee joint, is what makes the synovial fluid. It absorbs the bad stuff out and it brings the good stuff into the fluid. And so you need to move it around so that that fluid can circulate and get into the linings and refresh itself so that your meniscus can have a better chance at healing. Not to mention the loss of muscle activity. So if you're just still not doing anything, bed rest for 2 weeks, one of the worst things you could do. Your muscles will weaken so fast. They atrophy really fast. Muscle loss happens multiple times faster than muscle gain. So you're trying to fight muscle loss as much as possible when you're dealing with a knee injury, because you need muscle in the area to be able to do activity. Now, we'll fix the muscle imbalance. That's going to happen. But in the early stages when you're all flared up, you need to just work on not losing muscle and flaring down the knee. So do what you can. Do what you can tolerate. And once it heals a little bit, enough for you to be on your feet some more, then we can talk about doing more exercise. There's different phases to this. It's a process to heal your meniscus. But you shouldn't be resting, like completely bed rest. That's not a good idea. You need to be doing some activity that doesn't hurt your knee. Number 6 is walking. Now, walking is absolutely terrible for a meniscus tear when it's flared up, when your meniscus hurts, when it hurts to walk. You should not be walking, because when you stand up and walk, you're putting compressive forces through your meniscus, and the meniscus is designed to take compression. It's designed to take pressure from your body weight as you walk. But if it hurts to do it, then that means that the meniscus is not prepared. It's not healthy enough to do it. So you're just going to aggravate it more. You're going to worsen the tear. You're going to get more swollen. So you shouldn't be walking for exercise. It's bad advice from healthcare professionals when they tell you to walk for your meniscus and your meniscus hurts. You got to realize that the medical system at large does not know how to heal a meniscus naturally. Their solution is to operate on it, a meniscectomy or a meniscus repair, medications and injections. There's some pain reliever, anti-inflammatory medication, or there's all kinds of injections, stem cells, PRP, the hyaluronic acid, efforts to improve the cartilage inside the knee is what they'll inject in. But none of these solutions decrease the pressure in the joint. And the meniscus is a pressure-taking tissue. So mechanically speaking, we need to decrease the pressure to allow it to heal. And then once it's able to take some pressure because it's healed some, then we need to gradually increase the load. If you're in those early stages of a meniscus tear, it hurts, it's swollen, you shouldn't be walking. You should not be walking. You need to be off your feet and working on other things to get to the point where your meniscus can take walking safely without making it worse. But walking as a blanket treatment is so commonly done in healthcare. Physicians, surgeons will often say, well, try walking. We did this injection, now you can walk on it. It doesn't solve the root problem. Or you took the medication, let's see if you can get in a mile every day. It's not gonna fix it. Temporary solution. We did this meniscus surgery, we cut this chunk out, so now you won't have that flap in there that's causing you pain. Yeah, but you still are gonna over-compress the joint because your quads are so dominant and you don't have enough strength in your glutes. The pressures are all messed up in your leg. So now you're gonna go re-injure it. You're gonna get another tear. Or you're gonna get arthritis faster because now you have less cartilage in your knee because they cut it out. They cut out a chunk of your meniscus. There's research studies showing that if you have a meniscectomy, a meniscus removal surgery, you're going to get knee arthritis faster. And it just makes sense because you have less meniscus tissue to cushion your bones. You're just gonna rub the bones more. Number 7, my last one, very similar to walking, is cycling. It's another common exercise given by healthcare professionals. Physical therapy clinics often put people on the bike or the treadmill, of course, and they'll say, well, it's low impact, repetitive motion for the knee. And so we're circulating the fluid now. It is good for your knee. And at face value, it makes sense. You're getting high reps, which is what cartilage needs to heal, with low impact, low pressure through the joint, which is overall a good thing. The problem is, what muscles are you using on the bike? Because if you are on there for long enough to feel muscles burning, more often than not, 9 plus out of 10 times, I'd say 97% of the time, people feel their quads working, not the glutes. People feel their hamstrings working, not the glutes. Now you can make it, you can consciously think about what muscle you're using to pedal on a bicycle, whether it's an outdoor bike, stationary bike, recumbent bike. There's all different kinds of bikes out there. It doesn't matter. You can make yourself use your glutes more, but you have to consciously do it. Yeah, you have to be able to even independently fire your glutes, like apart from your thigh muscles and left apart from the right side. You have to figure that out first. And for some people, for most people, they can't even do that. So to instruct somebody to get on a bike for 10 minutes or 30 minutes or longer in hopes that they're going to heal their meniscus is so wrong. In the short term, you might feel better, but in the long term, you're only strengthening the quads, the thigh muscles. And when you get to walking, when you get to that advanced activity, because you have healed a little bit, you're setting yourself up for the next meniscus tear or worsening your current meniscus tear. Or if you had a meniscus surgery already, you're just going to re-injure it. So I think you shouldn't be walking, you shouldn't be cycling until you've figured out how to use your glutes properly. Then at that point, go ahead and cycle. Go ahead and walk. It's going to be productive for you at that point. But until you hit that point, it's destructive for you. If you want to see more videos to help your meniscus heal naturally and avoid surgery, check out this playlist right here where we've got all the videos that we have on YouTube related to healing your meniscus so that you can avoid surgery.